Iolani Palace isn't where you'd expect to find the director of the National Heart, Lung, and Blood Institute. But the urgent need to address nationwide cardiovascular health issues brought Dr. Gary Gibbons to Hawaii, a state greatly affected by health disparities.
Well, I'm delighted to be here as the director of the National Heart, Lung, and Blood Institute. It's an opportunity to understand health disparities, particularly affecting Indigenous populations, that particularly in the Pacific and the Native Hawaiian population, where there are burdens of disproportionately of cardiovascular disease and risk factors such as high blood pressure and diabetes that really carry a high burden of mortality and morbidity.
Dr. Gibbons delivered a keynote presentation at the 2016 Hehuliau International Indigenous Health Symposium. He is collaborating with the University of Hawaii investigators to explore why these cardiovascular health issues pose a serious threat to Indigenous populations.
Our institute is investing in investigators, some of whom are here in Hawaii, who are pursuing an understanding to figure out why these disproportionate burdens exist among certain populations, and then more importantly, figuring out what we can do to turn the tide and make a difference.
Multiple projects at the Johnny Burns School of Medicine have received funds from the National Heart, Lung, and Blood Institute, one being the Ka Holo Project, which focuses on preventing cardiovascular disease in Native Hawaiian people.
As we all know, medicine's different nowadays. We're not dying from infectious diseases, we're dying from chronic diseases. This is a lifestyle. And so what we're offering too is creating a new breed of physicians that really get it about social determinants of health and the other factors that contribute to health. 15 minutes in a doc's room, they spend their lifetime in their communities with their families and friends. How do you make medicine real for these people?
And here, learning the history of Indigenous populations is where making medicine real begins.